Afternoon, folks. This is Jim Fiorentini. Today we have 124 people, unfortunately, in Haverhill who have been affected with COVID-19. There were 10 new cases reported today. We did a lot of testing, or the city and the area did a lot of testing this past weekend, so we were expecting the names to go up. No one in Haverhill, fortunately, has died, but we have deaths in all of the other communities, and our heart goes out. Every person that died has a brother, a mother, a father, a son, a daughter, and our heart goes out to each and every one of them. Of the people in Haverhill, we have 7 who are hospitalized. The people who are hospitalized, as we most feared, are people with pre-existing conditions and the very frail elderly, the people who are most at risk from COVID-19. The people who have been infected in the city is spread throughout all age groups, genders, nationalities. The Latino community is being hit harder than their population numbers would reflect. About 20% of the city is Latino, and about 31% of the people whom we've recorded as being infected are Latino. And this probably reflects the jobs that they do, many of them working in the food manufacturing industry, where they are most at risk, and our heart goes out to them. What concerns me a great deal is that 90 of the people who are infected in Haverhill are under the age of 60. And that tells me that not everybody is taking the social distancing guidelines as seriously as we would like them to take them. It also might reflect that many of the younger people are working in industries where they're exposed. Not everyone who gets sick from this disease dies from it. I want to stress that to you. If you know somebody that's ill, you don't need to panic over this. The overwhelming number of people do recover. 2 people that I know well have been infected with the disease, and I'm certainly hoping that they're okay. Right now, 35 people have recovered and been released from quarantine to whatever semblance of a normal life is still left. Having people recover is going to be the key to having our economy return. Dr. Fauci says that once you've recovered, you probably have immunity from the disease, just as you do from any other virus once you get it. The whole area is stepping up testing. This is going to result in some much higher numbers coming in, but ultimately testing is a good thing, and that's what we want. You have to be screened by someone in order to be tested. You cannot just go down to a facility and get tested. I want to stress that. Every facility does it just a little bit differently. So I thought I'd outline that. At the Holy Family Hospitals in Haverhill and in Methuen, they're doing drive-through testing, but you must be referred by your primary care physician. Lawrence General Hospital, you call them, you call the hospital first, not your primary care physician, and they'll screen you on the telephone. If they feel you need testing, they'll schedule you for an appointment. At Urgent Care, also known as AFC in Methuen, they're at 380 Merrimack Street in Methuen. They're doing drive-through testing tomorrow, Good Friday, from 8 to 3. They have the new test, which will result in, you'll get a result in 45 minutes. If you'd like to be tested by Urgent Care, you have to call them, not your primary physician. And as with all of these places, you cannot just walk in. You call them at 781-430-8161 if you want to do the drive-through test, a 45-minute test tomorrow. On a couple of other topics, all related to this, a few weeks ago, the governor issued social distancing guidelines that said that you shouldn't be outside in groups larger than 10 people, and that everyone in the group, regardless of how many people were in it, should be at least 6 feet apart. We feel that these guidelines don't go far enough, not with the degree of the problem we have today. But even for those guidelines, we don't have a means of enforcing them. So this week, we became the first city in the state to pass a local ordinance giving us the ability to enforce those guidelines. And we don't want to actually fine anybody. What we want to do is send a strong message. Please stay inside, particularly over the next couple of weeks. You've all seen the national news. You'll know that there is some light on the horizon. This is a time to double down, not to let up. We're all concerned everywhere in the country, and particularly here in Haverhill, with our senior citizens. Most of the people hospitalized are senior citizens, and the people in other cities who are dying are mostly our frail elderly. Today I asked our public health nurse, she does a wonderful job, her name is Mary Connolly, to reach out to at least one of the nursing homes, and we'll reach out to the rest of them as soon as we have a chance, to see if we can assist them getting every one of their staff members tested. We don't want a staff member in one of these nursing homes. They're on the front lines, it's risky for them, and we don't want any of them to get sick where they might infect the frail elderly. We're also reaching out to everyone in the city who's 80 years of age or older. We're calling every one of them to say, how can we help you? How can we assist you? What can we do? Our goal is to call everybody 75 or older. Now, if any of you need help, I want you to go to the City of Haverhill website, www.cityofhaverhill.com, and check out the services we have available. We'll try to match you up to a volunteer that can assist you. During the regular business hours, you can call 311. Remember, it's one call to City Hall. Call 311. If for any reason it doesn't work, and it should inside the city, call 1-978-358-1311. That's 358-1311. And during the regular business hours, we'll do whatever we can to assist you. 311 is also up online for any city services you need. If you need to know how to pay your tax bill online, or if you have a pothole, whatever you need, one call to City Hall and we'll take care of you. We're in contact with food pantries. If you're listening and you're having trouble getting food, my heart went out to a few constituents who reached out to me and said, we don't have our food stamps, we can't get to the market, we can't get food, and we've been able to assist them and get food to them. If you're elderly or sick and you can't go grocery shopping, it's not a matter that you can't afford food, but you just can't get to the market. We'll try our best to find someone to shop for you. You know, and we know you're most at risk if you're a frail elderly, and we're going to try to help you and get someone to go and shop for you. I know that many of our people out there are hurting. I hear from you all the time, and my heart goes out to people who are unemployed. Thousands of people in Haverhill have lost their jobs. Businesses are going out of business, and our heart goes out to them. I heard today that the first people who applied for unemployment have started to receive their additional $600 per week in unemployment benefits. So check your checking account and see if you got it. If you need help with that, call my office, call your state representative, and they should be able to assist you. All the state reps and senators in this area are working really, really hard on constituent services. I know that many businesses are hurting desperately, and I know that the businesses who have applied for emergency help through the Small Business Administration are having a lot of trouble getting through. Again, our heart goes out to them. And the sole proprietors, for the first time, are able to apply for unemployment, but the unemployment office isn't set up to handle it. So they're not going to be able to apply until April 30th, and we think that's tough. They're applying in other states, but there's really nothing we can do about that. And why they didn't add enough people to help is just beyond me. And a couple of other things in other news. There'll be a special meeting of the Board of Health this coming Monday, April 13th, Easter Monday, at 3 p.m. in room 301. They'll be discussing whether or not we could or should, whether we have the legal authority to go beyond the state and impose additional guidelines that the state doesn't impose. Some of the things they'll be considering are, should the city require essential workers to wear masks when they're at work? Should the city allow essential workers who bring their own masks to be able to wear them? I've been very upset by things I've heard on social media, and that they are true, that some essential workers go to work, bring masks with them, and their employers won't allow them to wear them. should we pass a regulation that will require the employer to allow these people who are on the front lines to be able to wear the mask that they bring themselves. We know that there's some very, very great businesses out there who are going above and beyond what they have to keep the public safe. I want to single two out tonight. Carter's Ice Cream, which is not taking people in the lines anymore. They're only going to sell quarts and pints, and we think that's wonderful. And Fantini Bakery, which is taking people's temperatures before we allow them to go to work. But not everyone does that. So the Board of Health is going to ask if essential employers with more than 100 employees should screen employees for high temperatures before they report to work. And there's a lot of controversy about that, whether or not these temperature screenings are accurate and whether or not they really work, etc. Well, this is my first try at Facebook Live. I see a lot of messages coming in, and I'll try to figure out a way to answer them. I'm not really sure how to do this, so those of you that are more tech savvy, send me a note. I'll be back again tomorrow. I'm not certain I'm going to do this on Saturday or not. I'll let you know. I definitely will not be doing this on Easter Sunday, but I do want to wish all of you a very happy Easter. Happy Easter and best wishes. Easter, for those of us that are Christian, I'm Catholic, is a time for a rebirth, and let's hope it's a rebirth and a new time of hope and opportunity for all of us. I'll be looking at your messages and try to respond. Thanks for listening.